Well, welcome to the keynote session of the America's Long-Term Crisis Journalism Fellowship Program. It's a collaboration between the National Press Foundation and AARP. We're so pleased to be here tonight with two people from AARP who are really going to give us the contextual foundation that we're going to need over the next 2.5 days. In fact, Kim Sedmak of AARP reminded me that former First Lady Rosalind Carter was one of the first people to shine the light on the topic of long-term care. And certainly as she and President Carter are about to make their transition, this is an important moment for us to think about them and their contributions overall, but certainly Mrs. Carter's work and efforts on behalf of this topic are something we should consider. But she said, there are only 4 kinds of people in the world: those that have been caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. And that really sums up not only the discussion we just had with Sandeep Jahar, but the heartbeat of this issue. This is not something that any of us will escape having to know about. And so we're here, and we're greatly privileged this evening to be hearing from two people who are going to really set the stage and help us get going tomorrow morning. To my immediate left is Deborah Whitman. She's an economist and an expert on aging issues. As the Chief Public Policy Officer for AARP, she leads a team of 150 experts in all aspects of policy development, analysis, research, and global thought leadership around aging issues. She and her teams produce policy and research insights that help communities, lawmakers, and people in the private sector improve the way we age and how we live our lives. And next to Deborah is Susan Reinhardt. She's the Senior Vice President at AARP and directs its Public Policy Institute, which is the focal point for public policy research and analysis at the state, federal, and international levels. She leads the PPI's family caregiving initiatives and also serves as the chief strategist for the Center to Champion Nursing in America, which is a national resource center that was created to ensure that America has the highly skilled nurses that it will need to provide care. Deborah and Susan, thank you so much for joining us for this discussion tonight. We're so grateful for you.
Thank you to the National Press Foundation and all of you for coming here and taking part on this really important issue.
You know, Deborah, when people use the term economist, we kind of see, a bookworm with,
I got the glasses.
Well, you got the glasses. But it doesn't capture the fullness of what it is that you do when it comes to helping develop thought about policy in this realm. So why don't we start by having you tell us a little bit about what you do for AARP and where you want us to get started on this issue.
Yeah, well, so first of all, I need you guys to do your jobs on this topic. And I'll talk a little bit about AARP for those of you who are not over 50 and we have not sent you an invitation to join. I will say anybody of all ages can join, so you can all be members too, even if you're in your 20s, and we get good discounts. But AARP is a social mission organization. Our goal is to help people choose how they live as they age. And so we have over 30 million members, and we work with our members to make sure that they have the information and all of the things that matter to them. We're a communications company. We have the most read magazine in the world. Maybe somebody has written an article for AARP, the magazine, the bulletin, or our websites. During COVID, we were a COVID communications company. And I think we were one of the more reliable organizations that people felt that they could get real information from. Now, I don't do that membership for the communications. We're also an advocacy powerhouse. We have the largest t-shirt budget in America, we like to claim, because we put red shirts on all of our volunteers and our members and march them into Capitol Hill or into their state houses to try and advocate on behalf of themselves as well as others. I don't do advocacy, but what I do is a lot of the things that you guys are going to need for your writing and your stories. So Susan is my head of the Public Policy Institute. Susan will talk a little bit about her work on long-term care and caregiving, but I have in PPI experts on Medicare, Medicaid, Social Security, pensions. I have housing and transportation experts. The whole range of issues you're going to write on aging, I want us to be your go-to resource. I also have a research team that does surveys and analysis, and we put out tons of information. There was a really good survey that we did on sex after 40, that if you're looking for a story that's going to do good numbers, I encourage you to check that one out. I have an international team, so we look at how people are aging throughout the world, and somebody's going to want to steal this beautiful cover and magazine that we put together. We did a tour around New Zealand last year to particularly study how the Maori population is being dealt with as they age, and a country that struggles with disparities but is actually addressing it. So we wanted to learn from that. I have a thought leadership team. We're doing a global aging conference in 3 weeks that'll look at aging in the global south, because low and middle income countries, that's where most of the growth of the aging population is. So we have all of these resources. And one of the reasons why we sponsor this is that you will turn to AARP and you'll know that we have those when you're writing a story, that we can be a go-to place. Because we have good data, we have good experts, and we have good insights. That's my hope, and one of the reasons why we sponsor it.
Let's get you to speak specifically about long-term care and caregiving. We'll be hearing from several people who will help us understand the state level challenges, and we'll talk about the national strategy. But from your perspective, again, leading the research and the thought development about this topic, what do journalists in this room need to take into these sessions in their understanding about long-term caregiving in America and policy?
Can I take it a totally different direction?
Take it my direction first. And then
Well, because Susan's really the one to answer that question. She is the world's leading expert on long-term care and caregiving. So I hesitate to say that I know more to how to answer that question, but I guess I would just say the number one thing, our system is messed up. Our caregivers are overburdened. We don't have payment systems, as you heard from our previous speaker, or many of you who have gone through this themselves. It is ungodly expensive, and our systems do not help the families cover it. So,
I guess then that's actually what I wanted you to help us sort of set the framework for, the role of policy in this discussion. What do journalists need to be considering in terms of how to look at their state legislatures or what federal policies they need to know? Give us some sort of high-level thought on how keeping track of that is going to help their coverage.
So the main program that pays for long-term care is your Medicaid program. Susan will talk about our state scorecard, which has lots of details about what your particular state. But again, it only pays for it if you have no assets and no income. Basically, if you're very, very poor, the levels depend on the states. So that means mostly families are on their own. I think long-term care is the bubbling up issue of our society that policymakers just have ignored and not dealt with, partially because it's extremely expensive, and partially because it's looked at as the non-healthcare part of it as a family's responsibility. And I think our systems, and we need to pressure people to really think through, both at the state and the federal level, where a lot of the bigger programs are decided, to figure out how to do it. Now, I can go into history, which you'll probably have other speakers. There was a provision of the Affordable Care Act that would have provided long-term care. It was not designed to be actuarially solvent, and there was a provision put in that if it wasn't actuarially solvent, then it went away. So for years, advocates such as AARP and others fought to try and have a program. We almost did, but there hasn't been a really strong push by Congress to take on this issue at the federal level.
I always am baffled by the resistance to these kinds of policies. When you think of the fact that in America, the voting weight, the people who vote, the people who have the money are older people. And I always wonder as why there is such resistance or not support for these kinds of policies.
I would like to say we have a very loud voice, but there are very strong competing priorities. And as I said, it is extremely expensive by the time you add up all of the need that's out there. So members of Congress that are fiscally conservative are not excited about adding new entitlements or other programs that have very large budgetary implications. So we kind of get stuck of it's so expensive for individuals that the government isn't taking it on, which means that families are having to bear that burden. Often, mother falls a hip at the next day, you're starting to have to pay, very, very high bills. The amount of time, it's not something you plan for. You save up in a 529 for your parents in the same way that you save up for your kids. I don't know, other than having the voice of the people. This is one of the reasons why we're funding this. How do we get more people engaged in the need to make change? That's why we need you all.
I'm very glad you mentioned the term competing priorities. That's something that all of you as journalists, particularly covering social issues and education and health, really keep that in the back of your mind. So much legislation that seems common sense has a hard time coming to light because of competing priorities. So keep that in mind. So how many of you joined the media call about the long-term scorecard? So if you did, you have already met Susan Reinhardt. Susan is a nationally recognized expert on health and long-term care issues as the senior vice president. So I thought maybe what I'd like to ask you to do now, Susan, is to give us sort of a recap of the scorecard release, and then we can talk about some basic caregiving issues.
So the scorecard, it's actually got a very long name. It's Innovations and Opportunities, the 2023 Long-Term Services and Support State Scorecard. And it's over 180 pages. But do not despair. There's lots of help. There's lots of, on the website, I think it's ltsschoices.aarp.org now. It really breaks it down, and it does it by state, and it does it by different interest areas you might be concerned about. So, and I want to thank Sarita, who is here, who is one of our funders from the SCAN Foundation. We also have the Commonwealth Fund and the John A. Hartford Foundation. This has been 15 years in the making. We release this every 3 years, so this is the most recent one. And we're very excited about this one because it has 50 different areas to look at. We had been doing like 26. So there's a lot there. Speaking to family caregiving, you want me to turn there first?
Yes,
So
please.
speaking to family caregiving, there are 5 dimensions in this, like 50 indicators, 5 dimensions. One whole dimension is family caregiving. It's equal to the other dimensions. This isn't a little bit. This is very strong. You need to be paying attention to family caregiving as much as you need to pay attention to access and affordability and quality and choices and community integration. It's big. And as Deb has already said, these are the family caregivers are the backbone of long-term care. We know this. For many years we've known this, but not everybody pays attention, right? But they are the ones. So we want to really look at the policies that can support family caregivers. And I guess the good news around this, following this over all these years, since 2011 was the first scorecard, is that a lot of progress was made initially around things like the CARE Act, which had to do with helping people whose family members were leaving a hospital learn more about what they were expected to do. You know, I always say things that when I was a nursing student, made me shake a little bit, right? What they have to do. But we have 45 states and territories that did that already. There's lots more that we need to do. We need to do family caregiver tax credits. We need to do paid family leave. We need to do sick leave. We need to do flexible sick leave. Very few states have done that. So you'll see if the states you're interested in or nationally, which states, this is doable. When we see some states do it, why can't the other states do it? And the whole goal of the scorecard is to do that, to set that up, to show progress and where you might look for promising practices in states that have done good things and where you can do to make that happen in your state. And ideally, we set it up by states because that's where most of the policy is happening. But ideally, we would like to see the federal government take up more. As Deb was just saying, it would be ideal if they can. But since that hasn't happened, it really has fallen to the states over the years.
And can I just jump on that? I worked in the Senate for about a decade, which is why I sort of bemoan the fall of the Class Act, which was the provision that was part of the ACA. States are now starting to say, well, if they're not going to do it, then we've got to do something. And so we're seeing states like Washington State dip its toe in the water to try and provide a benefit for caregivers that's capped. Hawaii, you've been to all these states to go talk to them, but you know, where we don't see national leadership, and you all know, which the government almost shut down today because we couldn't even pass simple bills that are required by the Constitution to pass. These big type of issues really get stuck in the politics here in Washington. And so states are taking them on. They're understanding that they need to act, and we're trying to both encourage that as well as show where how one state does something so that others can take over.
I was going to ask that. I don't know if you did that during the media briefing, but can you name a state that's really doing a good job right now?
So we have what we call tiers of states. So which are the ones that have been showing the most progress? And there's 5 tiers. In the top tier, we've had repeatedly Washington, it's Minnesota is number 1, and Washington, and they flip every once in a while. So they're very kind of, that's why we have them as a tier. But the Washington, D.C. popped up as number 3, which was kind of a news thing. That's because we added information on community integration, transportation, housing, other kinds of multi-sector plans on aging, other things that we hadn't looked at before. So they popped up. And we have Massachusetts, for example. So we have those states, but I would call out in particular Washington and Minnesota. And the reason I would, not only because they keep popping up each time, but because they have statutes that they have passed like in the 70s and the 80s that said, this is what we want as a society. So you had, in particular in Washington State, you had independence, dignity, and choice. This is in their statute. This is what we want all of our citizens to have, older adults and people with disabilities. And the same thing in Minnesota. So that even though you have a change in governor, you have a change in legislators, the statute remains. And the multi-sector plans on aging, I'm looking at Sarita because they Scan Foundation has been really supporting this idea, is very similar to that. It's having a plan that has a vision, that has policies in it, that has an implementation plan, that has multi-sectors. It's not just aging, it's people with disabilities, it's the legislature, it's the private sector coming together that's saying, we want this in our states. And Deb actually put that in her book, I believe, right? Do you want to say some more about that?
I think we'll talk about it later.
Okay.
Yes. So I'm so glad you mentioned Washington, D.C. Doing fairly well on this issue, because we'll be doing our field trip to Iona Senior Services. And they received about $1 million grant from HHS to provide memory care services and dementia supports in Congress Heights, which is a low-income, primarily African-American community here in D.C. So we'll be talking about equity in that mostly of the sessions on Tuesday. But let's talk about what you found in the long-term care scorecard in terms of equity.
In terms of equity. So this is the first time we've been able to do this. We've been wanting to do it. There's such little data. So when we say equity, the way we define it in the scorecard, with the help of national experts, with the help of people who have been doing research for a long time, as well as the states and other users of the scorecard, we have talked about all people getting the best care across race and ethnicity. So if one group is not doing well, the state doesn't do well. It's got to be everybody does well. That was a big piece of defining how equity. And of course, we'd like more than race and ethnicity, but that's the only data we have. And by the way, it's mainly nursing homes. So we have it for 11 states, 11 indicators, but only 9 of the 11 are nursing home. We have to have more data to be able to do this. And I know you know this, or many of you know this, but keep pushing that in your publications. Data, because we believe action happens when you have data to help inform the way. That's what we really do. So in nursing homes, we have found tremendous disparities, tremendous. Just taking one example, in terms of the number of hours of care that people can receive, if you are Black in a nursing home, you will get 200 hours less care per year than others. This is not acceptable. This has not been seen before. Nobody has published this before. We don't want to be the only ones publishing things. We just want to put a highlight on, look at this. And we would love other researchers to get out there. We want other advocates to get out there, but this is not good. So we're just beginning, and we know that we have to do more, but it's the first step.
You've set up really a conversation that I want Deb to lead, and that is, I'm sure you're aware of the push to save local journalism in America. We saw the raid in Marion County on the local newspaper there, and we see so many small newspapers and media outlets in communities dying to where we have these sort of dead zones in various parts of America. When it comes to this issue, and you mentioned the term earlier about a vision, fueling a vision, fueling conversations about this, what can journalists like the ones in this room do to help fuel a public perception about the need for policies, the need for long-term care, what families need to know? What would you say about their role in that?
I think it's essential. Again, all politics is local. As I said, none of the members of Congress here are going to act on something that their constituency doesn't bang on the door and tell them it's important. Personal stories, I think, are incredibly powerful. I've heard from so many of you tonight that have personal connections, whether it's through the caregivers themselves or having had needed care with your own family. But then what you're doing now is to educate yourself and be able to understand, well, they're doing it this way in Washington State. Why aren't we doing it that way in Tennessee or Montana or wherever you are all from? I think it is important, as Susan said, to have that data too, to showcase what is going on in your state and why it could be better. Get people angry about it, and then tell them how it could be better. Show them either states that are doing it. Again, as I said, we write all kinds of stories about all the things that should be changed. So draw on our resources as well. You all have state AARP offices with state advocates who know the issues in your state. Reach out to them. I'm sure that they would love to talk to you about what they've been trying to push. When it is an issue, in particular, keep an eye on your state legislators. All of those things can make a huge difference.
We're going to be hearing also from Ajin Poo tomorrow. If any of you have ever heard her speak, you know what a treat we are in for, because her brilliance and her passion about the workforce. Paid work, the people in the workforce who are doing the heavy lifting around long-term care. Susan, why don't you talk to us about this issue of paid direct care workers? What do we need to know as journalists about that?
So we had spent a year, like 2 years ago, we did a whole year looking at what we should do for this scorecard. It's the fifth one, it's post-COVID. What are the issues? Workforce, family caregiving. You can imagine what would come up. Every state is experiencing a crisis in workforce shortages, whether it's in nursing homes or home and community-based services. Again, we tend to only have the data from the nursing home side. So this time we were able to include a number of indicators, one of which is around wages. So we know this is an underpaid workforce, and we looked at the wage competitiveness across states, looking at entry-level jobs, so similar kind of jobs for similar kind of entry requirements by state. And it's hugely different. No state is equal in competitiveness with other entry-level jobs. It's already lower paid across all states. So that's a problem to begin with. But then on top of that, you have a gap across states, upwards of $5 an hour difference. And I can tell you which states if you want to do it offline.
Meaning if you
could
go
be in the room.
if you go into caregiving, you get paid $5 less than if you took another entry-level job. I just want to make sure.
Actually, Susan, I'm going
Thank
to
you
put you
for
on
making that clear.
I'm going to put you on the spot, because I think it is important from a journalistic perspective for them to have a kind of a concrete idea of the gaps, who does it the best, and unfortunately, who does it the worst. So who would that be?
So surprisingly, I'm going to call on New York. Who's from New York? Anyone from New York?
I do.
Okay, there you go. Okay, so New York is number 6, ranked 6th in the country, doing great things. Our first scorecard, they were at the sort of the bottom quartile, we called it at the time. And over the years, they've really been working very hard, and they continue to do well. But in this area, they're a little over $4 an hour less in that. Why? Why is it that they aren't investing in the direct care workforce in a way that makes a difference across settings? This isn't just nursing homes. This is home and community-based services, right? California is another one, Washington, D.C. Some of our top states, I'll just call out those couple. But we have it all in the scorecard. You can look by state. Again, every state needs to work on this, though. We need to have stable wages for people that want a job that is so critical and so meaningful to people that can do this work. They need pathways. They need ways to increase their training and education, which AARP does a lot around, not particularly in this field, but wants to have people skill up, right? We need skilling up. And there are jobs to be had. You can become a licensed practical nurse, making more money. If you want to, you could go on to become a registered nurse or a social worker or a case manager or any number, a navigator. So these are entry-level jobs. That's why they're called entry. There's lots of possibility. There are many jobs in healthcare to be had, but we need people that are, not that I want everyone to leave the direct care workforce, but to know that they have options. So we need to work on this, and states are waking up to making that happen, as is the federal government. I think the administration has put more money into this area, so we need states and others that can apply for the grants to be taking them up.
Before I open it up to questions, because I'm sure there are those out there, you mentioned that obviously the federal government needs to do a lot more in this role, but there is the national strategy for caregivers, and the White House did actually. I mean, I want you to talk about it, but from your perspective as an economist, as somebody who had worked in the federal government, is that any glimmer of hope that maybe things are turning?
I'll let you talk about what's in it, because you probably know all the bullet points. I think it's important to know that was done by executive order, which is limited in the things that the president can do without Congress acting, right? So we can't add a program to Medicare or expand Medicaid or create a new program without an act of Congress. So while we are really excited and very thankful for this focus on family caregiving, it's not going to get into this underlying financing issue that I think is at the root of a lot of families' struggles. So I'll turn it back to you.
So there is a national strategy that it is very exciting. There was an Alzheimer's national strategy for a dementia strategy. So that's a beginning. Part of it is to coordinate across the federal agencies that might be touching things. That's a beginning, so can we strengthen what is happening? But there are hundreds of recommendations, hundreds of them, and lots of opportunities, as we would say, to both the state and national and probably local levels as well. And so the work will be focusing what can be done and, getting the low-hanging fruit, as we like to say, and just keep building. But it is going to keep going on. There's another advisory committee that's just been appointed. There's a focus on implementation. So anything that gets attention to this is a help. But again, it has to really be acted on. And when you have hundreds of recommendations, that's a little hard. So we keep trying to focus it as much as we can.
If I were one of you, I would take advantage of these experts who could help me think about my newsroom right now, or my state, or my city that I'm living in. So I'm opening it up for questions. Who'd like to go first? And
It's
introduce yourself,
Nina.
please.
I know it's Nina,
Nina.
not Nina.
It's
Nina.
not Nina. Nina Cackley from Mount Public again. So you mentioned that there were states that had taken steps to do the tax credits and other incentives that were helpful. Minnesota, I think you said Washington State. Imagine you are in front of Vermont lawmakers pitching why they should do that. I know it's been discussed, but for whatever reason, it's gotten pushed to the side. Give me your elevator pitch. Why should they do it?
Well, first of all, we know how many caregivers there are in Vermont. We know every state. We know there are 48 million caregivers. We have it by state. We know how much in unpaid care they are giving. So when you put that out to legislators, we need them to, stay on the job. Now, some people don't like that. Do you really want caregivers to have to stay on the job? Well, they want to be. They're already doing it. Could we help them do it? Most of them are working. 60% are working. And they're putting out over $7,000 a year in out-of-pocket costs. If you're more than an hour away, it's closer to over $11,000. So how do we help them continue this work? Because if they don't do it, those people are going into nursing homes. And that is going to cost the state a lot of money. You will spend down in a nursing home within 5 months, guaranteed, no matter what your income is, pretty much. So it is a matter of the economics, putting it out there. These are the dollars that would matter to you. But it's also, how do you help people that you want to retain them as employees? We have a very low unemployment rate. You want them to be employed. You want the wisdom at work that they can provide. Help them a little. It's actually, these tax credits are not as dramatic as we would like them to be. It's a little bit of help, but it means so much to family caregivers.
And I think I would also use the argument about, if people are having to make the choice between their job or taking care of their families, that's a Faustian choice. And it's really bad for the Vermont economy. 1 in 10 family caregivers who are working actually leave their job. That means that they're not then paying their income taxes, their property taxes, all the other things that Vermont needs. We need to help people in order so that they can do both. That would be my
But what we can do is give you the talking points from the states that passed it.
Yeah. And we can connect you with our Vermont folks at AARP Vermont, and I'm sure that they have a lot of tailored things directly for your state. And know the champions. I think that's another thing that we can help you with, is that our state offices often work with the state legislator, so they know who's actually interested in this. Spotlighting those people, giving them some encouragement, talking about who's the barriers. Those are also ways I think that you guys can be helpful as journalists for showcasing what's going on in your communities.
Question here.
And I should say, AARP members over 50, we still love newspapers and news and magazines. And if you're looking at your readers, again, these are the types of stories that your readers are interested in. So, I feel like this is good for your own career as well as good for us. So it's mutually beneficial.
I actually have a ton of questions, but I will try and edit myself, which is always hard. One of the things I run into, I often talk to our local ACA group, and their whole thing is like those. In Arizona, we have 143 nursing homes. We have 3,000 assisted living facilities. Assisted living facilities are not regulated by the federal government. So that's another question I have. Like, obviously, the scorecard didn't look at ALFs at all, but we have so many group homes and centers. And so how to get, I don't even know how to go about getting that data, like what that looks like. And then the other thing is, I always hear, well, we can't pay more. Like our DCWs can go to Costco and make a ton more money because Medicare or Medicaid is not reimbursing us. I don't know enough about Medicare and Medicaid to push back sometimes on that question, because it's like, really? How much do you guys make in private, for a private nursing home or that's not a nonprofit? Because I think the nonprofits are a little bit better with their staffing hour and ratios, and which would go into my other question about like this proposed staffing mandate. But just like with the questions when it comes to nursing homes and we can't afford to pay them more, what do you say to that?
So the scorecard does include assisted living, but only supply.
What does that mean?
In other words, we have the supply of assisted living in every state.
Okay.
It is in the scorecard, but not
The
regulations.
number of.
The number of, not,
Okay.
not.
Yeah, but like
the regulations, right? But we don't have the regulations for nursing homes either. But anyways, there's a little bit there. So how can you afford it? I think the first thing you just said is making some differentiation between for-profit and not-for-profit, which is, it's not our data, other data exist. The staffing regulations, for example, I've been informed, this isn't my data, but I've been informed that if the regulations that were proposed by the White House were to go into effect, 90% of for-profit nursing homes could not meet them.
right.
60% of not-for-profit couldn't make them. So it's still hard, but the not-for-profits are better staffed to begin with. I'm not making any political comment. This is just data. This is what it is.
We're just talking.
But what it does say, and I found this with even looking at vaccination rates, I was talking over here about vaccination rates. If you look at across and look at data across, you will find pockets of amazing excellence. So we paint brushes with the average, the this, the that, which we have to do, right? But you can find nursing homes that do pay well for their workers. How do they do it? They do it. They just do it. They make the decision to do it, and they figure out how to do it. So it is doable. Is it what owners want to do? Is it what? I'm not saying that they shouldn't get any more funding. I'm not saying that at all. I'm just saying that there are decisions to be made at the ownership level, and we can find those owners that are doing what they need to do.
Can you answer a question about Medicaid reimbursement rates versus private pay?
Medicaid rates are lower than private pay.
So when they say it's an unfunded mandate, what's coming? An unfunded mandate. What's coming with the staffing, the proposed staffing mandates? How do you feel about that?
About having unfunded
When you hear
mandates.
that, is that accurate? It's an unfunded mandate.
Well, that's a term of art, I would just say. Of it's how do I put it? This is what you need to take care of people. That's what it is. This is what we believe by research, by a lot of consensus, this is what it's needed. After that, it becomes a political discussion.
And I would just say, like, people in nursing homes need care, right? That's the whole reason that they're there. And you heard during the pandemic where staffing levels were ungodly low in some places during some periods. And life, health, mental capacity, all of those things suffered. So, we should, if we go to a facility where the government is paying, be able to require that people are well cared for in those places. So it's a quality issue, I think, as the administration would say, to make sure people get the care that they need while they're in a house.
I totally agree. I think what I've run into, like I'll hear a lawmaker in Arizona say something like, in fact, one actually said this, my great-grandmother has Alzheimer's disease. I totally understand Alzheimer's. It's a big issue. Will they vote to add additional dollars? I mean, they've done some. They're going to create a state plan and invest, I think, $300,000 to hire 2 people for our state Department of Health. I can't recall exactly what they'll be doing. But I sit back and I hear these comments of, my great-grandmother had Alzheimer's. And as somebody whose mother had Alzheimer's and is reporting on this issue, it's frustrating after a while because I don't see action. And in all the stories I write, I'm like, what's it going to take?
Yeah.
What's it going to take? I mean, there have been horror stories, and it's
You know what you're
moving that needle.
inspiring me to do is do more of what are the good stories out there? Seriously, because they're out there. And we found it by, Deb and I were both looking at the incidence of vaccination rates and who's doing well and why is it they're doing well. So thank you for that input, because maybe we can work with others to find where it is
Find those
happening.
good stories in Arizona, and I will try to report that.
Well, and let me give Susan a shout out. I told you we were a COVID communications company for quite a while. Susan and her team jumped right on and created a nursing home dashboard for COVID, looking at the number of cases, vaccinations, access to PPE, and was tracking that all through the pandemic, and are still tracking it. And the numbers are going up of deaths in nursing homes yet again with the most recent wave. And the number of vaccinations is nowhere near 100% all over. So one of the things that they did last year is they talked to nursing homes in the same area, one that would have a high number and one would have a low number, and sort of try and get underneath why that is. And do you want to say what you found? Because I think it was insightful.
Yeah, I was just talking over with our dinner mates over here too, that it was very interesting to talk to the same nurse practitioner that worked at 3 different nursing homes under the same ownership umbrella in Tennessee, and why that would be. And I can't get you all the details. I'm happy to talk to anyone offline. But there are things that are structural, like the information that comes. This nurse practitioner in one nursing home could find out who hasn't gotten it, who of my patients, residents, haven't received it. So then I can go and talk to them. She said it usually took like 3 times to talk to them about, not to force it, but just what are your questions, blah, 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 right? Another one, it was the CNAs, the certified nursing assistants, seemed to take leadership themselves because they wanted themselves to be protected and they wanted to protect their residents. So they took it upon themselves. So some of it is leadership is everything, right? But some of it is I have to say all of it is very local. It's very, very local, but some of it can be fixed by systems issues. Like why couldn't that whole chain, I'll just say, fix their information system so that the doctors and nurse practitioners would know who needed vaccines and who didn't. So a lot more has to be done around that. So we just started that, more can be done.
And Kathy, I'll just say, like, if we didn't learn from the pandemic that our nursing home and long-term care system is broken because we lost more people in our nursing homes than anywhere else, like that wasn't enough to get us to really take a hard look and do something that's different. I'm still shocked and appalled.
As I say, I'm scared what it will take for us to see that.
Yeah.
Any other questions out here?
Thank you. I'm Thomas Hughes from Bay City News. We cover the Bay Area in California, and one of the counties we cover is Santa Clara County. they did their own survey among health caregivers in the county, and they came back and said that they had, of course, many priorities, but 2 priorities rose above them all. One was just getting information, reliable information. We've got that covered. That's what we're doing here. But the second was respite care. It was always at the top of their list. Temporary, a weekend or a couple weeks, anything to give people a break, and then the sort of symbiotic way that that could help caregivers as well in the longevity of it. And I wonder how that fits, respite care as a sort of narrow category, how that fits into the scorecard, if that's something that also that Minnesota and Washington are doing well, and what other states can sort of follow their lead to do.
So we're very happy. It was the first time we could get respite into the scorecard. Part of it was defining respite. What do we really mean? Some could say having a person's family member go into a nursing home is complete respite. I don't think that's what we mean, right? It's really having somebody that's at home that's giving you a break, right? So we do have and we got this information from the National Academy for State Health Policy, who looked at the waivers and which ones were covering respite. That was like the beginning of this. But a lot of our state offices are prioritizing respite care. They have for years, but trying to get funding not only under Medicaid. It has to be for people who are not only on Medicaid. And there's various models. We've written a paper about this, and we're going to look at volunteer. There are volunteer opportunities around it. There are affordable options for respite. But I so agree with you. Family caregivers need a break. Adult daycare, by the way, has been an amazing opportunity for both the person, for socialization, being with others, going to a place that they could be for a couple of hours a day. But the research has been very clear from Steve Zarrett that shows it reduces the burden for a family caregiver. Under COVID, many of those adult daycare facilities closed, and that is shown as in our scorecard as what we believe is a consequence of COVID. So those businesses need to be regenerated again. There are small businesses that need help to get back on track.
There was a question over here. Let's go here and then back to you.
Kate Chiamarisi, 90.5 WESA in Pittsburgh. I don't know like all the ins and outs, but I know that part of the Build Back Better proposal did have, some money for caregiving that would address some of the underlying, structural issues. And I know that's like the part that didn't pass. Is that just like forever dead, or is there any hope of any of that, passing in any form anytime soon?
I can't say politically, and that's not my job, politically, what's going to happen. But I can say there was AARP, the American Rescue Plan, that did give money to states that they had to spend very quickly, actually, over the couple of years that they have been able to do it. And those states, we're actually having a meeting in Colorado in a couple of weeks to look at the sustainability of those plans. But many of them took elements of what was in what you just discussed around workforce, around respite care, around family caregivers, a whole variety of what we call infrastructure that they have been doing it. They were exhausted. One of them was in the meeting that we had on Thursday. I think you might have been there when she was saying like, oh my gosh, it was so hard. They didn't have much time to do it all. They didn't have enough staff, but many of the states have done it. Maybe that can happen again. Another AARP plan, which was money into the hands of the states to do what they needed to do. And if they have a multi-sector plan on aging, they know what to do.
Thanks. Alex with NBC News. I just want to follow up on the question on some of the programs that are out there to help caregivers with mental health and, to get a break, whether it's respite care or some of the tax credits that you mentioned. What are the programs structurally that you're seeing get the most bang for a state's buck or a policymaker's buck in terms of really having a strong impact on the mental health and well-being of caregivers?
Well, thank you for that. I think the states are trying to put together community-based opportunities. You heard, if you were here for the speaker before, these villages almost, to the extent people being able to interact in maybe not a whole community, but it might be cafes that they can get together. I was saying to you earlier, Weight Watchers. we've seen sprout up as an opportunity for particularly women who talk about what's going on in their lives and why their eating is affected by what's going on in their lives. So trying to identify those natural meeting places is something that is happening with our state offices at a very local level to try to support all of that. The other thing I would mention is the caregivers of people with mental illness, and Deb and I have both experienced this. I think you like to say in utero. You can explain what I mean by that. And I have this in my family quite a bit. And our data from the caregiving in the U.S. demonstrates that there are as many family caregivers of people with mental illness as there are of people with dementia. But we do not talk about that because it's hard enough around dementia, the stigma around dementia, but the stigma around mental illness, you can't really talk about your daughter with mental illness or your grandmother with mental illness. So they don't talk about it, and they are the most invisible family caregivers. And that was a report by the National Alliance for Caregiving. It was called something about pins and needles. It was a great report. But I appreciate that. And we have to look at caregivers of people with dementia, people with mental illness, people with strokes. There's all kinds of situations that happen. So thank you for that.
And Susan alluded, my grandmother had schizophrenia. My mother was her caregiver for 40 years. So I lived with her my whole life, and that, I think, led me to the work that I'm doing right now. Our team did some research on millennial family caregivers and student caregivers, which I encourage you all to dig up. Millennial caregivers, younger caregivers, are more likely to take care of somebody with a mental health issue, because it could be a parent, an aunt, a brother, sister, some other family member. I'll say another thing that I think I'm really proud of what AARP does. You heard the I have no idea where to go or what to do conversation in the last one. We have tons of resources for family caregivers. Our Prepare to Care guide is excellent, really simple checklists, information at the local level in your state of what to find. Susan and her team, Susan's a nurse, so they did a whole series of videos in several languages, you'll keep me honest which ones, of how to give a shot, how to change a catheter, all these things that make nurses queasy when they have to do, but we expect your son or daughter or husband or wife or other family caregiver to do for you. And so those videos, again, can take that stress off. Wound care, I remember, as being one of your most popular ones. When you're dealing with these things and not knowing how to do them, but knowing that the person that you're caring for really, really needs it. My brother-in-law was taking care of his mother. And the nurse would come at the end, 5 days a week, but on the weekend, he had to change her feeding bag and change the batteries and make sure everything was sterile. And I just remember him sort of shaking doing it because he was so worried that he would hurt his mother, this was his job for 2 days. And that's what we sort of put on family caregivers, is that level of thing. So all the resources that we try to push out there, I think also is our attempt to help ease that sense of aloneness and fear and lack of understanding.
I just want to add to that I think, Kim, you said there is or somebody has a whole resource packet. Is it in their packet? You're going to send it. So we have compiled, I didn't, I should say they did, the communications folks compiled a whole set of resources, which includes what Deb just talked about and others that you'll send afterwards. Is that right? Okay, thank you. Thank you.
I'm glad you mentioned millennial and younger caregivers because Alex, we Zoomed, so we connected. Isn't Richard Louis, one of his films, Sky Blossom, isn't that about younger?
Yeah.
Tell us a little bit about
sure.
that.
The first film we did was about 5 kids across the country, all of them in military families, because one of the things we saw in the work that you did was that it's especially prevalent in military families because oftentimes a service member comes back wounded, it falls upon the whole family unit, including the kids, to be part of the whole team that's helping the care for them. So we focused on those kids who are playing a big role in that.
And once again, we're thrilled to have Richard Louie joining us tomorrow evening as our final speaker on Monday, and he'll be talking about that and other issues. Susan, do you have one more thing?
I was just going to add to that one of the studies we did in New Jersey around something called nurse delegation, which means the nurse can teach the aide how to give the medication or whatever. It's some of the things Deb was just talking about. And there was a soldier in Fort Dix, New Jersey, this is where the study occurred, who had to come home at lunch every day to give his sister, who had a seizure disorder, had to give her medication or she could have a seizure. She had a worker, a full-time worker, paid under Medicaid, by the way, but the worker wasn't allowed to give the medication. So this soldier had to come for, I think it was like a half hour, 40-minute ride every day, round trip, all of that. And under this pilot that we did with the New Jersey Medicaid office, the nurse was able to delegate to the aide how to give us a pill that she took every day at the same time. It's not a big deal, but it was a big deal. And that soldier, he wrote to everyone what a difference this made in his life, as did his commander and everyone else. So there's some simple solutions here that make a big difference, in this case, in a person in the military.
We have unfortunately come to the end of this session, but I wanted to give Deborah the last opportunity to do something that you did so well last year, and that was talk about the consequences of covering aging correctly or incorrectly. What do we as a country miss out on when we don't get it right, when we don't communicate these issues?
Listen, it's complicated, and often we look at these issues as single issues when we're dealing with whole people. And there's some tropes out there that you all fall into that I want to strangle you. So last year I made us sing along. Social Security is not going bankrupt. That scares people. Even in 2034, it will be able to pay 80% of benefits, okay? So when you say bankrupt, you have all the people thinking they're going to get nothing. And you have future generations thinking they're going to get nothing, so they're not going to support the program either. So you can say Social Security will have a shortfall. The trust funds will run out, but no more is going bankrupt, okay? You need to look at all of the issues of people's financial well-being, their mental well-being, and their health care simultaneously when you're writing these stories. We talked a little bit about the cost of long-term care. I should look it up, but the average Social Security check is like $20,000 a year. And you heard home care, memory care was $80,000. The average nursing home is about $100,000. So again, $20,000 in, all this going out. And when I say Social Security check, that's Social Security not net of my Medicare that is taken out of my Social Security check. So half in 2030, half of my Social Security check is going to be eaten up by Medicare costs. And if I'm in my 80s, 80% of my Social Security check is going to be eaten up by my health care and long-term care costs. So when we're talking about these issues, they are all related for individuals. When we talk about cognitive decline and dementia, it's also related because I have a harder time managing my money. I'm going to need some more help. I'm unable to work longer. So I really encourage you. I had a whole spiel. I could have gone on for like a half hour of how all of these things are woven together when it comes to people that I encourage you to include in your reporting. But make sure you give context when you say how expensive something is. And the average Social Security check is $20,000. And that's not including what we take out from Medicare. Because that's what I think is missing a lot in reporting, where we look at these issues as if they're in isolation. And I know that's, you're only given so many words, and there's a lot of interesting things you're trying to put in stories. But I do encourage you to understand that we are having a change in our society like we've never seen before, where we have more older people than we have children. When the baby boomers were children, they cost a lot of money, and we all built a lot of schools, and we all paid for their education. And then after the war, we also helped people get housing. I could go on about how only 1% of housing is actually accessible for the older population. I'm sure that in your communities, you realize that there's a lot of places with stairs that don't actually work for people to age into. All of these things are things that we at AARP are working on. So again, I know I'm a used car salesman here, but it's actually a new car sale that I'm trying to give you, is that these things are complicated. There is a lot going on. You're going to get to hear some amazing people over the next couple days, both from my team and from others. I hope that this inspires you to look towards the future and try to help us make it better. I hope it inspires you because I think I've spoken to at least 10 of you of how these issues touch your own personal life. And I hope you use that in your reporting, because you may have experienced something that is a story that needs to be shared.
And that was a brilliant way to end this session, because I think it does prepare us for the next 2.5 days of, again, interesting conversations, insightful conversations, and important conversations. So let's take this opportunity right now to show our thanks to Deborah Whitman and Susan Reinhardt.
Thank you all.